Good evening, everybody, and welcome to Validation and Instrument Processing because partially sterile is not an option. My name is Marie Fluent. I am a general dentist and I have 30 plus years in the dental profession. 25 years of those were as a practicing dentist, and now I am an infection control consultant, speaker, author on infection control and instrument processing and OSHA compliance as well, and a little bit on antibiotic resistance and stewardship. So I welcome you all this evening and thank you for joining me for this very important webinar. This webinar came about because I realized that when a patient is seated in the dental operatory, she or he assumes that the packaged instruments on the bracket table ready to be used are indeed clean and sterile. And the patient may be confident that these are safe for dental care, or they may express concerns, or they may be sitting in the chair and remain silent but worry. And dental team members can also experience similar concerns even when following proper policies and protocols. So the question remains, since sterility cannot be seen, how do we really know that our instruments have been adequately cleaned and sterilized? This webinar will address instrument cleaning validation as the first step to ensure the delivery of sterile instruments for safe patient care, because partially sterile is not an option. Today we're going to talk about the instrument processing pathway and some of the steps involved in cleaning, disinfection, and sterilization as recommended by Centers for Disease Control in our primary guideline document, Guidelines for Infection Control in the Dental Healthcare Setting 2003. We'll also talk about another couple of CDC documents as well. We'll talk about the importance of instrument cleaning. Why is it important to clean if you are indeed going to sterilize? We're going to describe methods of validation to ensure that the equipment used for instrument cleaning is indeed functioning correctly. We're going to talk about the importance of mechanical, chemical, and biological monitoring, and talk about how to implement validation and monitoring applications into your practice. This webinar has been sponsored by SciCan, and having said that, I want to thank SciCan for sponsoring me and this webinar, but I also want to assure you as attendees that I'm not promoting any specific product, recommending or mandating that you use any product. This is an evidence-based presentation and based primarily on our regulatory guidelines available to us in the United States. Now, this is the instrument processing pathway, and this is the cyclical turn of events that instruments take on a daily basis continuously throughout the workday. First, instruments are used on patients and are left on the bracket table after patient care. Once the patient is dismissed, they are indeed transported to the central sterilization area or the processing area. There is a pre-cleaning step that is optional. And of course, once you pre-clean, you must rinse the residual chemicals from the instruments at that point. Instruments are then cleaned, and we'll talk about the cleaning methods in upcoming slides. Most offices use an ultrasonic cleaner, and instrument washers are available as well. Then instruments are packaged. They go through the autoclave, and then they are stored and ready for the next patient. Now, there are two areas within the instrument processing pathway that can be validated. First, we can look at our instrument cleaning process in automated equipment for instrument cleaning, such as the ultrasonic or the instrument washer, and we can validate that, and that means are our instruments indeed becoming clean. And then we can also validate sterilization and assure ourselves that instruments are indeed sterile and ready for safe patient care. And we're going to talk about validation in both of these areas. Before we do that, let's talk about some of the agencies that impact cleaning and sterilization of dental instruments in the United States. Keep in mind that this webinar is United States based, and these agencies are in the United States. Having said that, many countries around the world do recognize our Centers for Disease Control and our guidelines that for instrument processing and infection control control in the dental healthcare setting. So it is applicable, the principles are still applicable wherever you might be residing, and the policies may differ depending on the country of your origin and where you practice. I would like to point out from this the logo on the lower right-hand side, OSAP, Organization for Safety, Asepsis, and Prevention, and that is our one and only infection control organization dedicated exclusively to the practice of dentistry. So if you ever need any more resources with regard to instrument processing, I encourage you to look at OSAP. Now, all of these agencies have an impact of cleaning and sterilization in dentistry in the United States. And because I have so many attendees from other countries and welcome folks from around the world, I would like to share with you my first quiz question. The first quiz question says, the following agencies provide guidance and regulations for cleaning and sterilization of dental instruments in the United States. The answer is all of the above. I just didn't want to confuse any of my attendees who might be from other countries. In the United States, you also need to be aware of your state dental board. You may have regulations that may differ ever so slightly. OSHA is certainly a regulatory agency. Many states have their own individualized OSHA, state-run OSHA plan that you need to be aware of that's up and beyond the federal OSHA plan. The Joint Commission is an accrediting agency that may impact those of you who practice either in large group practices, some DSOs, hospital settings, institutional settings, military settings, general practice residency programs, etc. So you might need to be aware of that agency as well. The Joint Commission typically does not impact those of us in private practice in the United States, so keep that in mind as well. The Food and Drug Administration certainly has their hands in on dental instruments, and the agency on the upper left-hand side, AMI, the American Association of Medical Instrumentation. We'll talk about that agency in just a second. Well, speak of the devil, here is AMI right now, Association for Advancement of Medical Instrumentation. AMI produces many publications, and the one that we are most familiar with, or maybe most familiar with in dentistry, is a document called ST79 that is the go-to reference for steam sterilization for all healthcare settings, including dentistry. Now, our medical colleagues are very familiar with this document, but we in dentistry, this is a document that exists behind the scenes. It's behind the scenes because manufacturers must pay attention to the AMI guidelines, ST79, and manufacturers must provide, they must comply with these AMI standards. They must provide readable and understandable instructions per use that are indicated in the AMI ST79 document. And as a result of all of the above, dental team members must follow the instructions for use to be in compliance. And I share this with you because when I stress the importance of following instructions for use and what the manufacturer has to say about a particular piece of equipment or dental material or some of the products that we use for infection control, we must comply with manufacturer's instructions, and in doing so, we are indeed in compliance with AMI. So AMI is behind the scenes, and you will notice throughout this presentation, I will stress over and over again the importance of following manufacturer's instructions. This slide shows some of the documents that should be available to us in our infection control and compliance library in the United States at a minimum. In the center of the document, you will see the CDC guidelines, and this is the principal document I was sharing with you earlier. It was written in 2003. As a result of that, CDC looked at this document and said, boy, do we really need to update? Are these recommendations and guidelines still valid? And CDC came to the conclusion in 2016 that yes, the guidelines are still very valid and the recommendations still hold true, but the problem is compliance. So as a result of that, CDC came out with a new document on the upper left-hand side called Summary of Infection Prevention Practices in Dental Settings, basic expectations for care. This document is a little bit easier to read. It's written in plain language, and it gives the bare minimum of what we need to do to remain in compliance. At the end of this document, there is a two-part checklist, if you will. The first part is to assess our policies within the practice, and the second portion is to watch hands-on what we're physically doing on a day-to-day basis for compliance. And I encourage all of you to be familiar with this document wherever you practice around the world. It is an excellent document, and even if your policies may differ, the protocol, even if your protocol varies ever so slightly, the principles behind the infection control will remain the same. So I encourage all of you to be familiar with this. On the upper right-hand side is an OSHA compliance manual. This particular one was published by the American Dental Association, but there are a number of others that are very excellent resources as well. Then in addition to that, you need an office-specific compliance manual, and these are policies and protocols that are specific for your particular facility. And once again, they should be written down. What type of chemicals do you use? What's the make and manufacturer of your autoclave, etc. Information that's specific to your facility. On the lower left-hand side, once again, the owner's manuals and instructions for use for all reprocessing equipment. It's very, very important to have this information on standby as well. I shared on the last slide a little bit about these two CDC documents, but a little bit more about the summary. The summary, the document on the lower portion of the slide, it reaffirms that standard precautions really do work. They are the foundation of infection prevention, and the summary does highlight the existing CDC recommendations. The summary also includes the fundamental elements needed to prevent transmission in the dental setting, and of course the two-part checklist that I've already mentioned. And at the end of this document, there are a number of references. If you wanted more information, where do you go for specific infection control related topics? Now, here is a great resource for everybody around the world, wherever you might be practicing. This is the CDC Dental Check mobile app. You can download this app either to your cell phone or your mobile device or your computer, and it will give you access to the CDC checklists that I just described, and there's an image of them on the right-hand side. And it also provides links to the CDC guidelines and the CDC summary and all of the references that I mentioned previously as well. So the checklist can help you, you can perform the checklist using your mobile device and track the results right on your cell phone, and you can look back at them on a regular basis and evaluate at least annually. Now keep in mind, this is not mandated, it's not a regulation, but it is an excellent practice and a way for you to self-assess your practice to see how you are indeed doing and identify any weak spots that might need a little bit more attention. Now, in the CDC summary, there are little blue boxes periodically that provide key recommendations in certain areas of infection prevention. This, of course, is the key recommendations for sterilization and disinfection of patient care items for dental settings. And I'd like to spend a couple minutes and go through these with you and to know what the CD says. And of course, these are the bare minimum requirements for sterilization of patient care items in dentistry. Number one, we need to clean and reprocess reusable dental equipment appropriately before use on another patient. That's a given. Number two, we need to clean and reprocess reusable dental equipment according to the manufacturer's instructions. And there I go again with manufacturer's instructions. If the manufacturer does not provide instructions, the device may not be suitable for multi-patient use. In other words, if you don't have manufacturer's instructions, the item might be considered a single-use disposable item, and you may be required to discard it after using it a single time. As we go further into the instructions for use, have the instructions for reprocessing reusable dental instruments and equipment readily available, ideally in or near the reprocessing area. And that would be for equipment such as your ultrasonic or your autoclave or any type of cleaning equipment that you might have the instructions for use there. The third, assign responsibilities for reprocessing dental equipment to personnel with appropriate training. In other words, if you had somebody who was primarily at the front desk and all of a sudden you needed help with instrument processing, is that person trained to use this equipment? Does he or she know what they are doing? Are they protected against bloodborne pathogens? Do they know how to use personal protective equipment? So make sure that anybody in that reprocessing area who's handling contaminated instruments is trained to do so. Number 4, wear appropriate personal protective equipment when handling and reprocessing contaminated patient equipment. And number 5, use mechanical, chemical, and biological monitors according to the manufacturer's instructions to ensure the effectiveness of the sterilization process. Maintain sterilization records in accordance with state and local regulations, excuse me. So these are the bare minimum requirements, and you can see from our first slide, there were 2 areas where we can validate our instrument processing pathway. And you'll notice in this set of key recommendations from CDC, one thing is missing. And that one thing that is missing is the validation of cleaning. It is available to us. We can do it. I'm going to teach you how to in the upcoming slides, but it is not a recommendation of the CDC at this time. Keep in mind, if your facility is in an institution type of setting, a hospital setting, a learning center such as a general practice residency program, a hygiene training program, an assisting training program, you may be required to use to validate your cleaning process as well. I have a question that has come up right now. I'm monitoring the questions as we go. They have something about a revised version for the summary of infection prevention. This question is by Michelle, and I just want to say, Michelle, it is not a revision. It's kind of I kind of equivocate the CDC summary to way back in high school years when we had to use Cliff Notes during a literature course. We had a main body of literature that we had to read in our literature lessons, and then to supplement that, there was something called the Cliff's Notes. And the Cliff's Notes were not meant to replace the original document. They were meant to as an adjunct, as a learning tool. So the CDC summary is just that. It's a learning tool and a way to introduce, refresh, or stress key learning points of the original CDC document. So it's not a replacement, it's an adjunct to. I hope that's able to answer your question. And another question was, I'm unable to see everybody else's questions. Don't worry, I'm the only one who can see the questions here. So bear with me. And if I don't get to your question as I go through this webinar, there will be time for Q&A at the end of the session. So don't worry about that. But this question is so important. Brooke said she's seen some pushback from dentists regarding CDC recommendations. They say, well, those are just recommendations and not requirements, and we don't have to follow those rules. Is this true? What is the good response to this? The good response to this is, number one, if you are within the United States and practicing in the USA, check your state dental boards. Many state dental boards require that you are indeed in compliance with CDC guidelines. And if you are in one such state, you don't have a choice in the matter. You are legally obliged. For all other states, know that you are indeed under OSHA regulations, and OSHA does refer to CDC guidelines quite often. So keep that in mind as well. And if you are ever I hope this never happens, but if you find yourself in a court of law, CDC guidelines definitely definitely hold some ground. If you are in compliance with CDC guidelines, it will certainly be recognized in the court of law. My next question regards autoclaves, so bear with me as I get to that point. Going back to my slide, I stress the importance for the instructions for use. And I mentioned earlier that dental personnel must follow the instructions for use, and CDC recommends to have these instructions readily available where the device is being used. Now we will get right into cleaning. Cleaning is the first step in any decontamination process, according to CDC and any other organizations or agencies that impact medical or dental instrumentation. Instruments absolutely must be cleaned before they can be sterilized and ready for use. How clean is clean? Sometimes to the naked eye, an object may appear clean, but with a closer eye, you can find elements of debris, organic matter encrusted on the dental instruments. That absolutely must be cleaned off. If it is not and the instrument goes through the sterilizer, we cannot guarantee that the sterilant, meaning the steam and heat, can penetrate that debris and clean and disinfect and sterilize the instrument surface. So if you have a dental instrument coming out of the autoclave that has crusted on dental materials and such, but we cannot consider them sterile. In those situations, they must be re-cleaned and put back through the autoclave one more time. Okay, moving on to the next slide. Now, here are your three choices for instrument cleaning. First of all, hand scrubbing. And historically, that's the way instruments were cleaned. Running water and with a little scrub brush. And now it's required, if you are going to perform instrument cleaning, that you wear heavy-duty utility gloves. You are under running water. You have a long-handled brush, and you brush away from the instrument so that nobody has a chance to get hurt in this process. Keep in mind that this is the least effective and it poses the greatest risk to dental personnel when instrument cleaning. Second is an ultrasonic, and an ultrasonic is a countertop type of device for cleaning instruments. And most offices and most facilities, especially in the United States, use an ultrasonic for instrument cleaning. Third is a washer disinfector, an instrument washer, or it can be a washer slash disinfector. These devices are the most effective and provide the least risk to dental personnel who are processing instruments. And the reason is that you are handling instruments even less than you would in the other two methods. Instrument washers are very common in with our Canadian colleagues and our European colleagues, and in the United States they are catching on as well. Next slide are do's and don'ts for the use of the ultrasonic. When you use an ultrasonic, well, first of all, the ultrasonic works by producing sound waves that bomb blast the dental instruments within. They cause bubbles to implode, and it actually loosens up the debris on instruments. So there's a couple of things that you need to remember when using an ultrasonic. Number one, still wear your personal protective equipment, as these ultrasonic waves generate bubbles and such. Aerosols are also generated. We don't want any of those to splash onto your face or your skin or your mucosal tissues. So always wear PPE when using an ultrasonic. And once again, follow your manufacturer's instructions. Third, there is a metal basket for putting instruments in and removing instruments from the chamber of the ultrasonic, and keep the lid on during use. Use the correct amount of solutions and the correct type of solution when using an ultrasonic. In other words, it's inappropriate to use something like dishwasher solutions or detergents, household detergents in your ultrasonic. That would be inappropriate and not a correct use of the device. Change the solutions daily, and some of these some of these devices require changing more frequently than that. For instance, if you're in a high volume oral surgery practice and you've got lots of blood and bioburden in that chamber and you can see debris floating around, it's kind of like your dishwashing solution for a major holiday dinner. There's no harm in changing the dishwasher solution as you continue to clean your household dishes. There's no reason that you can't change your ultrasonic solutions as you are going through the clinical workday. Make sure that all instruments are submerged, and that would be underneath the water, and make sure that they are um, all underneath the water and nothing exposed to air. And don't overload your ultrasonic, and never interrupt the cleaning cycle. And I say this because sometimes I've seen dental personnel come in, put instruments in, close the lid, leave, another dental assistant entering the room, adding more instruments to the cycle. And at the end of the cycle, we don't know how many instruments were in there for the full period of time or for a partial period of time. So never disrupt or interrupt a cleaning cycle. By the way, I'm going to, well, I'll share with you in a couple more slides what are some major causes of process failures with instrument washing. Now, do's and don'ts for instrument washers. Once again, wear personal protective equipment when you put instruments in and remove instruments. Follow the manufacturer's instructions for use. Use the correct water. Use the type and a correct type and amount of detergent. Position the instruments and cassettes in there correctly. And make sure, this is something unique to instrument washers, that you have arms that rotate around through the cycle of the instrument washing. Make sure that they're free from debris and working correctly. Never put instruments in the instrument washer that don't belong. And the primary culprit in this category would be burrs, ortho wires. They can really wreak havoc with the mechanical components of the instrument washer, and they can you can also have an obstructed moving part of the instrument washer. So keep that in mind as well. Okay, there are different ways to validate instrument cleaning. Historically, we would use something called the foil test. The foil test I will describe in greater detail on the next slide, but also keep in mind that we can visually inspect the actual device itself. And many offices, particularly in surgical settings, they actually have a lit magnifying glass on standby where you can look at the instrument and look for any type of breaks or defects in the instrument, as well as any remaining bioburden or debris. So don't undermine visual inspection. Also, there is validation, and that's what I'm about to talk to you about right now. Number one is the foil test, and number two, verification testing strips. And I'll go into greater detail in just a second. Now, the historical foil test looks like this. To perform this test, what you would do is take a piece of aluminum household foil, approximately the diameter of the chamber or the basket within your ultrasonic, and you would hold it in place with the ultrasonic running, with your hands out of the device, that is, for about a minute. After 1 minute period of time, you should notice crinkling and crackling and maybe pits and holes within your foil. And if you see that, as is shown on the left-hand side of the screen, that is a pass. That means your ultrasonic is indeed performing as it should. A failure looks like the slide, the picture, or the image on the right-hand side. In this image, you've got complete bare spots. You have some holes here and there, but you have got some complete bare spots that show no crinkling or crackling whatsoever. If that happens, chances are your ultrasonic may not be able to be repaired. Chances are that you would be in store for the purchase of a whole new ultrasonic and the basket that gets placed within. So is cleaning validation required in private practice dental settings in the United States? Not at this time, but some institutional facilities say yes, and some larger group practice mandate this as well. If the manufacturer of your ultrasonic or instrument washer says that it is mandated in the instructions for use, then it is definitely a requirement. Even if it is not a requirement, think about cleaning validation as a best practice. Don't you want to know if your instruments are clean? Now, if your cleaning device fails a monitoring test, what do you do? First, you go back and review the manufacturer's instructions for use for the operation of this device, and then go back and retest the machine. If it's working, then its chances are what happened was operator error, and you are good to go. But if your device fails a second time, call in your manufacturer or service technician for further assistance, and keep in mind your manufacturer may be able to provide a loaner device if needed. Now, common causes of cleaning process failures, and I'd take a close look at this slide because this will be also in your assessment at the end of this course tonight. The main cause of cleaning process failures is overloading, and overloading of the ultrasonic and overloading of the instrument washer are both common causes of process failures. Also, not enough time or too low of a temperature in the ultrasonic, ineffective cavitation, meaning if your device is not providing equally distributed sound waves amongst all portions of the chamber, and inadequate detergent, meaning not enough detergent. The instrument washer can fail due to clogged arm sprays, inadequate water sprays, and once again, inadequate amounts of detergent dosing, in addition to, of course, overloading of the device. Now we are on to sterilization monitoring, and I see that some questions are coming in, but at this point I'm going to keep going so that we stay on track, and I'll address the questions at the end of the seminar. There are three methods of sterilization monitoring: mechanical, chemical, and biological monitoring of the autoclave. So what I need to let you know is that with mechanical, you are measuring the time, temperature, and pressure of the chamber within the autoclave. It does not guarantee that sterilization has occurred. It shows that the parameters for sterilization have been met and the device seems to be working and functioning correctly. Number two, chemical monitoring. Chemical monitors provide a change in color when physical parameters have been reached. And chemical monitoring, once again, does not guarantee sterility has occurred, but it shows that the parameters for sterilization have been met. And finally is biological monitoring, and sometimes this is referred to as a spore test. In biological monitoring, bacterial endospores are used to assess the sterilization process directly. And this is the only validation method that really guarantees that sterilization has occurred. And you'll probably see that on an assessment coming up as well. Mechanical and chemical do not guarantee sterilization has occurred, but biological monitoring does. So a little bit more about mechanical monitoring. With mechanical monitoring, we observe the mechanical readings within the autoclave or the sterilizer. Some new devices actually print out and send cycle parameters electronically. They can provide early indication of a cycle failure and tell you something's not right, and each load should be monitored with a mechanical indicator. Now this is really cool. This is incorporating new technology into mechanical monitoring. In this type of technology, there's a USB port within your autoclave or sterilizer, and you may have a flash drive to record every cycle, every day, every month, and every year. If you have internet connectivity, you can connect to the dental facilities network into the manufacturer. And sometimes the manufacturer will have somebody on standby evaluating these individual cycles, and they can identify a cycle fault or an error in the process before the staff on the dental team even recognize it. And it's kind of interesting to see that some dental facilities will receive a phone call saying, you've got a problem with your autoclave. The front desk personnel may say, no, we don't, it's working fine. And the manufacturer may say, yes, you do. You better check your mechanical monitoring because we're noticing X, Y, and Z. And what this does is it adds a layer of assurance that the machine is indeed working and you are indeed validating your process. So if you have a mechanical monitoring failure, number one, you should check the dials and gauges and make sure that everything seems to be working correctly. Of course, refer to your instructions for use. And if you're not getting anywhere with the instructions for use, don't hesitate to call the manufacturer or the service technician for further assistance. And don't use the unit or the autoclave until it's been cleared for service, until you are sure that it is indeed performing correctly. Now we are on to chemical monitoring, and once again, chemical monitors show that the parameters for sterilization have been met. They respond to a change in one or more of the process variables, and that can be steam, time, or temperature. And there are 6 classes of chemical indicators. I'll share with you what those are on the next slide. CDC recommendations with regard to chemical monitoring in the dental setting are pretty vague. They say place a chemical indicator inside each package. If the internal indicator is not visible from the outside, an external chemical indicator is also used on the package. So if you look on the left-hand side, you'll see the edge of a instrument pouch, and you can see that there are external chemical indicators on the outer portion of the seal, and one on the internal portion, and that serves as the internal chemical indicator. And most pouches have these. If your pouch does not, then you may have to put an internal chemical indicator in there as well. On the lower right-hand side, it shows an internal chemical indicator placed in a package that it contains a cassette. And in the center of the pouch, it shows a chemical indicator that is a class 4 or class 5. And I'll share with you more about that on our next slide. Now there are 6 types of chemical indicators. Historically, they were referred to as classes. Now they are referred to as type 1, type 2, type 3, type 4, 5, and 6, and they are indicated for specific purposes and processes for instrument sterilization. So a type 1 chemical indicator is an external chemical indicator, and a good example of that would be chemical indicator tape. The tape that you use to wrap up an instrument package using sterilization wrap. If you take this tape and you put it in the back seat of your car on a hot summer day, it will change colors. Is your car an example of all of the parameters for sterilization? No, it is not. So obviously there was no pressure. We don't know the temperature that it reached, and we don't know how long it was in there. So an external chemical indicator, the only thing it will really show you is, has this been through the autoclave? And it's a very important indicator to have because you can quickly identify sterile from unsterilized instruments quickly and easily. A type 2 is a Bowie-Dick test for a pre-vacuum sterilizer. And if you have a pre-vacuum sterilizer, you are supposed to use this, or should be using this at least once per day. And I won't get into Bowie-Dick tests or type 2 indicators during this webinar. Number 3 responds to only one parameter of sterilization process, typically temperature. Typically, these are used in dry heat sterilizers. In some practices, still use dry heat sterilization. Type 4 responds to 2 or more parameters in the sterilization process. Type 5 responds to all critical parameters in the sterilization process. And type 6 are emulators, and those really are not used in dentistry at this time. In dentistry, we're seeing more and more use of type 5 indicators. And for my Canadian colleagues who are on this call with me, especially those of you who practice in Ontario, you have specific requirements on which type to use and when, and your guidelines have an exact flow chart on how and when to use these specific types of chemical indicators. In the United States, we're not there yet. That time may be coming in dentistry. Our medical colleagues, of course, do use these different types of chemical indicators. And before I move on, I'll give you a quick little example of why and how they could be used, especially a type 5 indicator. Say you are performing a spore test once a week, and you use a mail-in service for processing your biological indicator. Say you perform the spore test on Monday, and the spore test comes back on Thursday saying, boy, you have a process failure. In that period of time, you have used instruments the rest of Monday, all day Tuesday, all day Wednesday, and part of the day Thursday until you received notification that there was a problem with your autoclave. If you had put a type 5 indicator into the autoclave chamber during the biological indicator cycle, you would have had immediate notification something's wrong, and you would have known not to use those instruments, not to use that autoclave until you evaluate what's going on in the autoclave. And that is why type 5s are recommended, and ideally at least once a day in the United States and within Canada, particularly in Ontario. Look at your guidelines for when and how to use these various chemical indicators. There's something called a process challenge device, and this is a device that simulates equal or greater challenge than the most difficult instrument or item routinely processed in the sterilization cycle. And what it is that you can have a type 5 chemical indicator in with a biological indicator, as I just described in my previous example. And you can create this yourself by putting the spore test and the type 5 indicator within an instrument pouch in the center of your chamber, or follow manufacturer's instructions, or you can purchase these and they are available commercially. And these may be required in Canadian provinces. They are, and if you are in a large group practice, a hospital, military facility, any type of hospital setting, then you are required to perform a process challenge device per the standard operating procedures of your facility. In private practice, this is not required at this time, but it is a best practice, and I would consider all of you to consider using a process challenge device to prevent the scenario that I just explained to you above. Now, if any of the chemical indicators fail, or the wrapping did not change color, don't use those instruments, don't use that sterilizer. You must troubleshoot and figure out what happened. In those scenarios, the instruments must be repackaged and you must reattempt to sterilize, of course, after you do your troubleshooting. Make sure that the sterilizer was not overloading. Look at the expiration dates on all of the packaging and chemical indicators. The containers for the chemical indicators will have an expiration date on them. Keep that in mind as well. Refer to the manufacturer's instructions for loading the sterilizer. Look at your mechanical monitoring settings to make sure it's working properly. If the chemical indicators still don't change color, call the manufacturer or a service technician, and don't use the sterilizer until it's been cleared for service. Now we are on to spore testing. Spore tests assess the effectiveness in killing the most resistant microorganisms, bacterial endospores. Bacterial endospores are very difficult to kill. They've got a very hard, crusty outer surface that's difficult to permeate or penetrate with the steam and the heat. And it's believed that if spores can be killed in an autoclave, all other microbes that are found on dental instruments will be killed as well. So spore tests do guarantee that instruments are being sterile. Now, CDC recommends that we perform spore testing at least weekly in the United States. Some state laws vary, so check your state laws and your state dental boards. And if you're in Canada, check your provincial laws as well. And they will vary from province to province. And in other countries, keep that in mind as well. I noticed that I've got a large component of attendees from the Middle East, particularly from Saudi Arabia. And I know that in Saudi Arabia, you do indeed follow CDC guidelines as well. If there's any changes in your sterilization procedure, meaning you've purchased new packaging materials, you have new personnel performing instrument processing, you have a new piece of equipment or a newly repaired piece of equipment, there's no harm in performing another spore test to ensure that the process is being performed correctly. And of course, any load containing an implantable device must have a spore test, and you quarantine the contents of that load until you know the results of the spore test. Now, my Canadian colleagues typically use the devices as seen on the lower right and the middle of the slide, and these are tabletop incubators where you can perform the spore test and incubate in office and receive the results typically that day or within 24 hours. And because you have more frequent requirements for monitoring, it's necessary to have these. In the United States, most facilities use a mail-in service, and you can see the envelope for that on the left-hand side. You are welcome to use a tabletop device, as you can see in the middle and the right-hand side of the slide as well, but keep in mind there are requirements for logging, maintaining a sterilization log, and I'll go over that in just a moment. Now, if you have a spore test, positive spore test, that means a failed a spore test. If you have a single spore test, it doesn't necessarily mean that the unit is malfunctioning. Keep in mind, most process failures are due to operator error. That means somebody did something incorrectly. So what you need to do is repeat the spore test, observing the mechanical and chemical indicators. Of course, look for human error, meaning overloading of the chamber, improper packaging or wrapping, insufficient exposure times. And if it passes the second time, you are good to go. Chances are it's operator error. Now, if your subsequent biological indicator fails, then stop, remove your sterilizer from service, obtain a loaner device. Hopefully you have a second device in your office so you do not have to stop practicing dentistry on that day. Review all your monitoring records since the last time you had a negative BI test. Confirm that all personnel who process instruments are following proper procedures, and retrieve all of the items since the last spore test because they may not be considered sterilized. And this is why we are required to label our instrument packages and date them so we can go back and retrieve them if necessary. Also, you need to determine whether or not you should identify and notify patients who may be impacted by a potential breach in infection prevention. And the CDC has much more information on its website on what to do if a subsequent biological indicator test fails. So always consult the CDC website and they will help guide you. Now, there we are required in the United States to have a logbook for sterilization and maintaining of records. And these records should include the physical parameters, meaning mechanical indicators, chemical indicator monitoring results, the sterilizer load number, or what I always put in when I was in practice, the time of date that it was put through the autoclave, the date of sterilization, any type of USB recording, chart, or printout, if available, of the mechanical monitoring, the load contents, and the person responsible for sterilization. And that way, if you needed to retrieve instrument packages or you had an operator error, this is not meant to point fingers, but it's meant to train and educate personnel who are performing instrument processing protocols. And remember that infection control, no matter what we're doing, it's a team approach. We're looking out for each other. We're not finger pointing and blaming each other if something goes wrong. We need to learn from this and move on. Now, with regard to maintaining equipment for cleaning and sterilization, it's a good idea to keep the owner's manuals in a designated location. If they're thrown in a drawer somewhere, chances are they're going to be lost, not available when needed, and possibly even thrown away. Keep your instructions for use. Make sure personnel who process instruments are adequately trained. Follow routine maintenance for all equipment and keep the information on file. So if your autoclave goes in for service or repair, keep documentation of that. Record if something happens with your device and there is an image shown on the display, record the error code. Don't just call the service technician and say it's not working. Say we have a service code that says X, Y, and Z, and it is showing X, Y, and Z. That way the service technician can help troubleshoot and streamline the whole repair process if needed. And always rely on the manufacturer's representative or the manufacturer themselves. They can help troubleshoot potential errors. They can determine whether the equipment requires repair or if it was just simply operator error. They can help facilitate loaner equipment and also can help training of personnel on proper use of equipment. There was a time where I had a new dental assistant in my facility, and the equipment that we had was different than what she was accustomed to using. So I brought in my manufacturer's technician and we had a lunch and learn session, and I asked him to share with us everything we needed to know about the water type, how to fill it, how to drain it, how to clean the filters, how to load it, how to ensure it was working correctly, everything we needed to know. So rely on those manufacturers' representatives. They are a wealth of information. Finally, here is my summary, and I would like to make sure that we all have a firm commitment to consistency and compliance. And consistency means that we perform the same functions the same way each and every time. Just as we do with regard to standard precautions and patient care, we should be applying the same principles to instrument processing. Our process should be consistent each and every time. I stress the importance of cleaning as the first step in any decontamination process. Pre-cleaning is a great first step to keep instruments moist, and enzymatic solutions can help break down bioburden prior to cleaning. If you are in a high volume practice, that may be an excellent option for you. Anytime you use chemicals in the cleaning or sterilization process, they must be rinsed from the instruments prior to the next step, whether it be cleaning or sterilization. Manufacturers have an integral role in infection control, and they're becoming more and more accountable, and that's why I stress the importance of following the instructions for use. And of course, finally, training of dental personnel is paramount. Now I have a list of resources available for you: the CDC guidelines, the CDC guidelines and the summary please look up both of these. And if you download the CDC Dental Check app, it will give you links to both of these documents. There's also another document for guideline for disinfection and sterilization in healthcare facilities. And this is what our medical colleagues utilize in their facilities, and the same principles apply to us. This document has many more details than is in our dental documents. In the event of a processing failure, look at the CDC guidelines, and I have a couple other resources available for you as well. Now at this point, what I'd like to do is have Trung pop on the line and share with us a little bit about our quiz and how to access that. And you can see that on the slide in front of you. And while you're looking at that, I will start in on answering some of the questions. So, a question from Christy says, do all autoclaves recommend different ways to place pouches? Instrument pouches have a plastic side and a paper side, and there seems to be confusion on how they should be placed in the autoclave, plastic up or plastic down. Now, the new autoclaves, most autoclaves that are manufactured today recommend plastic up, paper down, and some of the older autoclaves, the non-class B type, still recommend the opposite. So when in doubt, look at your manufacturer's instructions, and chances are, if it's a newer autoclave, the instructions will say plastic up, paper down, but confirm that with your instructions for use. Next question from Roy. Infection control practices all make sense, but do these practices work because no practice infection control also works? Roy, I don't really understand your question. Infection control practices make sense, but these practices work because no practice of infection control also works. Well, no practice of infection control works if you are in an ideal setting when none of your patients have a bloodborne pathogen that you need to be concerned with. But we really don't know the medical history of our patients who are seen in our clinics. We don't know the bloodborne pathogen standard. And if there's no accidents and no bloodborne pathogens, great, our infection control protocol seems to be working just fine. But somewhere down the line, somebody's going to have an occupational injury, somebody's going to have a needle stick episode, one of your patients is going to have a bloodborne disease that we're unaware of, and then what do you do? And that's why we practice standard precautions, and we follow all of these infection control recommendations and guidelines. The next question is also from Roy. Studies retrospectively of practices are non-compliant with infection control have also been found to transmit diseases from patients to instruments to patients. Roy, I'd like to consider that question with you, and I have a great article that I would like to share with you. It was written by Dr. Jennifer Cleveland from CDC, and it was written in 2016, published in the Journal of the American Dental Association. In this article, Dr. Jennifer Cleveland shares the actual cases that have been documented of disease transmission in the dental setting from 2003 to 2016. And it shows that while there are not many, that they do indeed exist, and the potential does exist for disease transmission in dentistry. Roy, if you cannot find that article, email me. My email address is on the very first slide. I'd be happy to discuss that with you further if I needed to. Next question is from an RDH. Stephanie says at some offices that she is temping in, she also uses rubbing alcohol to wipe instruments. Despite the risk of an occupational injury, she was taught in dental school that rubbing alcohol actually makes the bacteria adhere to the instruments or other hard surfaces. Is this true? Stephanie, you are indeed correct that alcohol can act as a fixative. That means make debris and bioburden adhere to the surface. So that is indeed true. So alcohol was done once upon a time before before standard precautions existed, but right now that's not standard of care and it is not recommended. And using alcohol on instruments, particularly composite placement instruments, can interfere with the adhesive component of your dental materials. So be very careful when you add a new element or a new chemical into your sterilization protocol and into your restorative procedures. It's not a good idea unless it's recommended by the manufacturer's instruction. Hannah says, is the solution changing frequency listed on the instructions? I have a dentist who only wants to change the solution once a week. Hannah, that's kind of like changing your dishwasher. If you were washing dishes by hand at home, it's kind of like changing your dish solution once a week at home. Kind of gross, kind of a bad idea, not a good practice. Read your instructions for use and they will state how often that the chemicals should be changed, and your CDC guidelines say at least daily. And depending on the practice where you work, with the state that you are in, you may be mandated to comply with CDC guidelines. Hannah, if that doesn't work for you, email me and I will provide more references for you. Kathleen, is it okay to place instruments into cassettes before putting them into an ultrasonic? The answer is yes. Ideally, that is the best solution. Ultrasonics are meant to, and cassettes are designed for the sound waves to permeate all of the little cracks and crevices and holes within the cassette to get to every instrument surface. And by doing that, you are handling these instruments less and less, and that's what we want to promote. We want to promote less manual handling of contaminated instruments. So yes, do that. Stephanie, just curious, what risks to our environment and our drinking water is it to have ultrasonic solution going down the drain all of the time? Has this been addressed? Stephanie, that's an excellent question. And as you are probably aware, we're being more and more attentive to being green friendly in the dental setting. Our enzymatic solutions do indeed break down as they are introduced into our water system. And look for, you'll see more and more environmentally friendly chemicals, more environmentally friendly packaging, and recycled materials, and less packaging used, etc. And yes, that is being addressed right now, and we're all trying to be a little bit more green friendly. But having said that, Stephanie, it's very important not to compromise our infection control protocol for the purpose of being green friendly. Our infection control protocol takes precedence. Next question, and my last question, and I am over the time limit, but I want to address it because it's my last question. Carol says, do mirrors have to go through the ultrasonic? It seems to damage the mirror surface. Carol, you are indeed correct. If you put ultrasonic, a mirror in the ultrasonic and it's adjacent to a scaling instrument, a perio probe, or an explorer, yes, you will see little Christmas tree type of designs from that ultrasonic pressing or scraping the explorer against the mirror surface. And this is a primary reason, another primary reason why cassettes are recommended. If you use instrument cassettes, all of your instruments are held within silicone rails, nice and tight, so that instruments cannot scrape back and forth and cause damage to the mirror surface. So consider cassettes in your practice, Carol, and if you need any more information on that, please contact me and I can talk to you a little bit more about the benefits of cassettes and how to implement them in your practice if you need to. So with that, I have answered all of the questions that have been posed to me. And with that, Trung will lead you to take your assessment. It's just 5 questions and it should be very, very easy. And I already gave you several of the answers. On that happy note, I want to thank all of you for attending this webinar this evening and spending the last hour with me. I was delighted to meet you virtually, and I hope our paths cross again. Thank you so much and have a good evening.
Here's how to take the CE exam at the end of the webinar. When the webinar is over, you may see some Zoom windows that are open. Close them all, including the one that says Join Meeting. Then return to the classroom page and click the Take Exam button. If you can't find the classroom page, go back to the website where you registered and make sure you are logged in. Look for one of these 4 links and click on it. Pending Exams, CE in Progress, My Account. You will then see one or more class titles. Click the title of this webinar and it will take you to the classroom page. Then click Take Exam. Thanks for your participation in Viva Learning webinars.